okay, this is probably the algorithm that you need to practice the least, okay? I honestly think this is going to be the shortest show me, and I think it's probably the one that if you're going to skip any of these, this is the one to skip, okay? But here we go. What I'm going to talk about is the asystole PEA algorithm. Asystole/PEA algorithm. Okay, you remember when I drew this in class, I drew it as a circle. And it's kind of circles and circles and more circles and more circles, okay? And then outside of the circle is an arrow. Once again, Bill can't draw arrows. Yeah, all right, and there's your arrow, right? And that arrow just says, once you're out of this circle, go to another algorithm, okay? And within this is CPR and EPI. And EPI is the brand of the 1 to 10,000. 10,000. That's my daughter in the background, by the way. 1 to 10,000. And darn it, I messed it all up. That's okay. I'll do it again. 1 to 10,000. 1 to 10,000. 1 milligram. 1 milligram of that epi 1 to 10,000. And really that's it. To be honest, that's it. It's CPR and epi, 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 CPR and epi. Okay? And then, of course, they tell us to look at our H's and T's to see if there's anything that we can fix. Okay? And as far as the H's and T's go, I'm not going to go over it in the show me. That's all really for you guys to go over sort of on your own. But for the H's and T's, basically the idea here is find out what's causing the asystole or the PEA and try to treat it. And if you're able to treat it, then maybe this patient will come out of asystole or PEA. Now, generally what the American Heart Association says is that after about 10 to 15 minutes of good ACLS, after about 10 to 15 minutes of good ACLS, you should be declaring this patient or calling this patient in the field. Okay? Unfortunate, but you should be calling this patient in the field. Really, the survival rate from asystole PEA greater than 10 minutes is almost zero. Statistically speaking, it's almost completely zero. Now, there are exceptions to this. And the big exception is when you have kids, and especially when you have cold kids, okay? Those that are in asystole or PEA because of hypothermia, they have a much better survival rate. Keep doing CPR. I think the record now is just over 2 hours of downtime. And the patient came back, it was a 2-year-old patient, came back and has almost no mental deficiency. Okay, so these are the patients that you want to go with. I would even say, to be completely honest, I would even say that I'm going to work on a patient in hypothermia pretty much regardless of age, right? And it's the old adage, they're not dead until they're warm and dead, right? Well, sort of, but you do want to make sure that you, if you have a patient that's hypothermic, that you give it as best you got, okay? So asystole PEA, CPR and epi, 10 to 15 minutes, good ACLS, you can then call them in the field. Think about your H's and T's, and again, that's for you to look over, and I want you to make sure that you look over that before the test. Think about your H's and T's, and then kind of go from there as to what you can do for this patient, okay? That's it. Asystole PEA, that's it. It's easy. It's pretty simple. It's asystole. Not much you can do about it. There's no shocking in asystole. There's no pacing, none of that kind of stuff. We don't try any of that kind of stuff. If it's PEA, it's PEA, right? We're not going through the bradycardia algorithm. If it's a Brady PEA, it's PEA, and that's all there is to it. All right, that's it. 5 minutes, exactly.